my name is Lindsay DiCarlo, and I'm the Outreach and Recruitment Coordinator for the PharmD program at the University of Wisconsin-Madison School of Pharmacy. Today, I will be taking a coffee break with Dr. Barry Gidal, professor for the Pharmacy Practice Division, about his responsibilities at working as a pharmacist, a researcher, and a faculty member. Thanks for taking a break with me today, Barry. What are we drinking today?
So today, you can see my Maui coffee cup. Actually, I'm drinking some Kona coffee today.
Ooh, yum.
Since I can't be in Hawaii, which is where I'd rather be at the moment, but that's okay.
Me too. With our snowstorm coming, I'm ready for some warm weather.
Yeah.
So, all right. So to kick us off, could you just tell us a little bit about your clinical work working as a practicing pharmacist?
Sure. So my area of work is in neurology. Specifically, I do work in epilepsy. So my clinical practice, and for about the past 30 years or so, has been at the Madison VA, the William S. Middleton VA. We have a comprehensive epilepsy program, and in fact, it's one of the oldest epilepsy programs in the country. And what my duties are, I don't work in a pharmacy. I'm a direct patient care provider. Within the federal system, within the VA system, we can have what's called a scope of practice, meaning that we actually are mid-level practitioners. Think of it kind of like a nurse practitioner. So I and my pharmacy resident, between us, we will see about 40% of the patients on an annual basis. They come to us and we're managing directly. They only see us and we're directly managing their medication.
Oh, wow. So I get a lot of questions from prospective students about, as a provider, mid-level provider, are you able to, so it sounds like you're able to prescribe,
Mm-hmm.
Do you diagnose, or is that still like the doctor's job?
Well, no, that's the difference between, a PharmD and an MD. My job is not to diagnose. So that doesn't mean that, every once in a while I pick up on something that has yet to be observed by somebody else, because sometimes our patients are only coming to see us, and it may be every 6 months, every 3 months, and if something new happens. But no, my primary job is not to diagnose. Once the epilepsy diagnosis has been made, and if, it's not always me frequently it's not me that initially starts the medicine, but then when it comes to just managing that, maybe increasing doses, maybe changing doses, maybe adding different medicines on, that's kind of what my role is.
Oh, that's really interesting. Okay. So how many days do you work in the clinic then?
So our clinic is on Monday mornings. So really I'm there for about 4 or 5 hours a week, once a day. There are occasions though where I have to, whether it's following up with patients or if I get labs back that I need to follow up with a patient, I may make phone calls at different times.
Okay. So on top of and the reason why you're only working 1 day a week, not only, but you're working 1 day a week in the clinic is because you have other responsibilities. Tell us a little bit more about those responsibilities.
Sure. So in addition to clinical practice, and I like to think of what I do and what a lot of us do is think of it as a big wheel. Everything ought to feed into everything else. So my area of research is with anti-seizure medications, and specifically the pharmacokinetics, meaning if pharmacokinetics is, think of it as the mathematical description of what happens when you take a pill. How it gets in, where it goes in the body, and how you get rid of it. And a lot of times there can be drug interactions. And so my area of focus is drug interactions. As we get these new medications, and especially now in the era of COVID, there's new treatments coming in. We're looking at some of those things, how they potentially interact or don't interact. So in addition to my practice, I do research and then also teaching. And I'm responsible for teaching in our neuropsychiatry course, which for our second-year pharmacy students, as well as actually some seminar courses for first-year students. And probably my most fun course is I co-coordinate and teach a cannabis course, cannabis and medicine.
That sounds interesting. I think that's a hot topic coming up in today's generation. Tell me a little bit more about that course, or why you think that's a relevant course for preparing future pharmacists.
Oh, I think it's going to be absolutely necessary. I think, you've probably seen that, cannabidiol, CBD, is sold everywhere. I know there is a prescription form of this medicine, which we know has some side effects and we know can cause drug interactions. So I worry about all the proliferation of all these compounds and people that are purporting that these things they're selling may be useful in treating different diseases. So I think it's incumbent on a pharmacist that we need to understand these medicines, we understand how the pharmacology, how they work, what the potential side effects, and what's really myth and fact. What do they help with? What is really not supported by the science? So I think a pharmacist needs to know that.
That's a key part to, I think, the healing process and to caring for and you're essential. It sounds like you're essential to the healthcare team. Without a pharmacist, you can't do this. You can't heal, right? You're essential to the healthcare team, right?
Well, I'm a big believer. Yes, I'm a big believer in the team approach to care. And, again, I work in my clinic. It's very multidisciplinary. There's a neurologist, there's a psychiatrist, a nurse practitioner, and then me and my pharmacy resident. And there are times when the discussion, we all come at things from a little bit of a different angle. And I think that's good. As a patient who's ill, it's good to have different perspectives and different expertise, working together.
I'll say from a non-healthcare provider, it's nice to hear from that your healthcare team is coming together. I think sometimes as a patient, you feel like, you're the one running around talking and trying to figure the things out and connect the dots. But to hear that a pharmacist is having such a key role to that healing, and that they're connecting the dots and having that role of figuring out a solution that's really important. So that's really neat to hear.
Well, I think one of the values that being a pharmacist, and what we certainly, I think, here at UW prepare our students to do, is learn how to ask the right questions, learn how to talk specifically about the medicines with the knowledge of pharmacology and the therapeutics. I think we ask things of our patients in a different way. Mm-hmm. And that's one thing I think we're really good at here is building those skill sets within the student, that they have the scientific expertise, but they also know how to communicate. They also know how to elicit that information and help weave that picture, that tapestry together. And so I think that's one of the strengths I think we have in our program.
So that's really awesome. That was actually one of the last questions I was going to ask you is, what do you think is rewarding about working as a pharmacist? Is there anything else you'd like to add about that?
Well, I take pleasure in all the things that I do professionally. I truly enjoy my research because I think every once in a while I get to add a sort of a little grain of sand to the big beach of knowledge. I'm keeping in Hawaii theme here. And that's very rewarding. I like when I'm working with students who really get interested. Again, we have a very strong neuroscience training here. I think both on the campus, UW campus, and within the School of Pharmacy. And it's really rewarding when we get students that are interested. But every week, I can say without fail, when I'm able to work with patients, even in this very difficult time that we're in right now, but when I'm able to work with patients, I can walk away. I know I've made a difference with somebody. Maybe my research ultimately makes a difference, I hope, but I know on a weekly basis, I can get that feedback, and that's really important to me.
That's awesome. That sounds like you're doing really, really rewarding work in neurology for your patients, for our community. So I just want to say thank you for the work you're doing. Thank you for joining me here today. Is there anything else you'd like to say? If not, we'll under coffee time.
Yeah, we'll finish the cone of coffee.
All right. Well, cheers. Happy day.
Thank you. Bye-bye.